guys, in this video we are going to be having a discussion about the most important images pertaining to the topic of cardiovascular system. In the initial part, I shall be first talking about the disorders affecting the blood vessels. Let's get started. The first important example of an image that they'll love to ask you in the exam would be in context of an example of a condition which is going to cause inflammation of the blood vessels. So that is what is being given the name of vasculitis. Now understand the fact and recall from our discussion in the main videos, vasculitis can be subdivided into two important categories. One, based upon the size of a vessel, you can be having a large vessel, a medium vessel or a small vessel vasculitis. And second, you can be having a granulomatous or a non-granulomatous vasculitis. So the initial discussion over here is going to be of an example of a large vessel vasculitis. And one of the most common examples of a vasculitis that is going to be seen in case of an adult individual, characterized by involvement of not only the aorta and its branches, but also the superficial temporal artery. Understandably, therefore, the condition I am making a mention of as of now is going to be given the name of temporal arteritis. Now, temporal arteritis at a histological level is an example of a granulomatous vasculitis, and this kind of a condition is therefore also given the other important name of a giant cell arteritis. This condition is classically going to be seen affecting individuals who are going to be relatively higher up in the age group, so more than 50 years of age. An individual who is going to be having the presence of clinical manifestations in the form of development of a localized pain, that is pain on the lateral margins of the forehead. He is going to be having the presence of myalgia. He is going to be having presence of arthralgia. A term that is typically given in your exam is going to be polymyalgia rheumatica. Please be familiar with the fact that a lot of these patients are going to be having a trouble as and when they're going to be chewing their food. So that is what is going to be given the name of jaw claudication, considered to be one of the very specific manifestations associated with temporal arteritis. The moment we are going to be talking about this kind of a condition, we understand the fact at a microscopic level, the condition is going to be causing involvement of the large vessels. And what you find over here is that because of the inflammation, as you can appreciate over here in the picture, there is a narrowing of the lumen. Also, because of the inflammation, the endothelial cells tend to get damaged. Therefore, there is a thrombus formation which further compromises the blood supply in the affected area. So, you're going to be having the presence of inflammation which is going to be affecting all the layers over here, and particularly associated with occlusion or narrowing of the lumen, thereby compromising the blood supply in the affected area. Now, this particular condition is an important example of a vasculitis. Point number one, because of the fact that this vasculitis is associated with a high value of ESR. So, that's a very important hint in the exam. So, mark my words, localized pain, jaw claudication, polymyalgia rheumatica, high ESR value, adult individual more than 50 years of age, all go in favor of a condition like giant cell arteritis. We also need to understand the fact that this would be an example of a condition which can be having a presentation in the form of sudden onset of blindness. So, there is a possibility that the patient can be having a presentation because of which he is going to be presenting in the ophthalmic emergency, that is a sudden onset of blindness. One of the very characteristic features that you associate with this kind of a condition obviously is because of the presence of such giant cells, which I hope you can appreciate on your screen, and therefore the name for the condition is giant cell arteritis. In order to have this kind of a histological picture, it's easy for us to understand that we will be required to take a temporal artery biopsy. So, ideally speaking, because this condition is going to be characterized by a patchy involvement, you need to take multiple biopsies, each of 1 centimeter size. However, in a real world situation, because the patient can be having a presentation in the form of sudden onset of blindness, you would not be waiting for the biopsy results to come and you straight away start the patient on something like intravenous steroid therapy. That would be responsible for saving the vision of your patient. So, keep that particular thing in your mind. Also, when we wish to talk about the histological manifestation over here, we wish to look at the elastin fibers over here, and elastin fibers over here can be picked up with the help of a stain which is given the name of Van Giesen stain. Now, please remember the fact, silver stains are going to be importantly asked in the exam. One, for the bacteria H. pylori, so that is what you associate with gastritis and the gastric adenocarcinoma. Two, the silver stains that we talk about in the brain, that's a Balchowski stain, remember that. And if you haven't watched the serious videos, please do watch the videos on the neurodegenerative disorders. And the third one I'm making a mention of is Van Giesen stain, which is typically responsible for causing staining of the elastin fibers. Particularly what we find over here in these patients, which is easy for us to make out, there is going to be a fragmentation at the level of the internal elastic lamina. So, the elastin fibers are damaged over here, and that is what is very characteristically being picked up over here with the help of the Van Giesen stain. That is what I would like you to be aware of over here. A similar condition, which is an example of a large vessel vasculitis, which is also granulomatous inflammation, but which typically affects individuals who are going to be relatively younger, is going to be given the name of Takayasu arteritis. Now, Takayasu, as you understand, is an example of a Japanese name. So the reason why this condition was discovered over there, and therefore the name. Now this condition is characterized by involvement of the aorta and its branches, but very characteristically the patients are going to be getting the involvement of the aortic arch. So because of the involvement of the aortic arch, as you can find over here, the condition is also going to be given the name of aortic arch syndrome. Takayasu arteritis is also important because from the aortic arch you are going to be having the origin of the subclavian vessels and the brachiocephalic trunk, which can be having an occlusion right over there, and therefore the patients are going to be having a reduction in the vascular supply at the level of the upper limbs. So much so that we recall the fact that this kind of a condition can also be associated with the term pulseless disease. So they may be giving you an example of a radiological manifestation like this, or they can be talking about a picture over here in which you have been shown the presence of a damage at the level of the aortic arch. Takayasu arteritis also has a significance with respect to the fact that, as I shared earlier, young individual having a clinical presentation in the form of sudden onset of blindness. So watch out for the question in the exam carefully. More than 50 years, sudden onset of blindness, granulomatous vasculitis, think in terms of giant cell arteritis. Younger patient, let us say patient who is 35 years of age, sudden onset of blindness, granulomatous vasculitis, think in terms of Takayasu arteritis. So age is a very, very important hint. Apart from that, in this condition, you are going to be having an absence of usually polymyalgia rheumatica manifestations. Takayasu arteritis also acquires significance because in these individuals, you can be having the involvement of the renal vessel. And why that becomes important is because if there is a vasculitis affecting the renal vessel, that could be responsible for causing a development of renovascular hypertension. In fact, one of the common causes of development of renovascular hypertension in young individuals in a country like India. Young individuals, country like India, renovascular hypertension, think in terms of Takayasu arteritis. Do not get foxed by the fact that Takayasu arteritis can be replaced with the term non-specific aortoarteritis in the exams. Recall the fact that if you're going to be preparing for an exam like the USMLE or for that matter CLAB or for that matter AMC, the commonest reason for development of renovascular hypertension in young individuals over there in the developed world, that is going to be answered in the exam as FMD, that is fibromuscular dysplasia. So that's just going to be an additional piece of information so that you do not goof up on the questions over there, right? So that is what is going to be required so far as Takayasu arteritis is concerned. The next important example of a vasculitis is what is loved by the examiners, and you have got question in the exam quite recently as well for this condition. The condition is going to be given the name of polyarteritis nodosa or PAN. Now, polyarteritis nodosa is an example of a vasculitis disorder which causes involvement of the medium-sized vessels. That's an example of a disorder causing involvement in case of young adults. Patients are going to be having the presence of a transmural inflammation which can be appreciated quite easily over here. So if you observe over here, the complete lumen almost has been occluded because of the presence of a thrombus, or there is going to be the presence of the edema in the vessel wall, and therefore the vascular supply is going to be greatly compromised. Polyarteritis nodosa in the recent exams, as you can recall, is going to be associated with an infectious cause that happens to be hepatitis B surface antigen. So the surface antigen and the corresponding antibody are responsible for the formation of immune complexes, which will remind you of the fact any immune complex disease is an example of what hypersensitivity? You get it right, type 3 hypersensitivity reaction. So this would be an example of an immune complex disease or hypersensitivity reaction subtype 3, characterized by the 30% people having a history of exposure to hepatitis B surface antigen. Now in this condition, you can get involvement of multiple organs in the body, but at the same time, you need to understand the fact that some organs are more frequently asked in the exam. Fact number 1, in these individuals, you never ever get involvement of the lungs. So lungs are spared. That is point number 1 that I would like you to recall. Fact number 2, patients can be having the involvement of the kidney. Yes, kidney involvement can be seen, but you never ever find the development of glomerulonephritis in these patients. Involvement of the neural tissue in polyarteritis nodosa has been associated with a manifestation which is termed as mononeuritis multiplex. When we talk about this kind of a condition, the condition is associated with the development of a typical pattern of necrosis that is going to be given the name of fibrinoid necrosis. From the main video section of general pathology, I presume you're aware of the fact fibrinoid necrosis is seen whenever there is a deposition of the plasma proteins, fibrinogen, fibrin, and you have the intravasation of the different types of stuff from the lumen into the vessel wall, thereby giving a pink homogeneous appearance, which you can appreciate perhaps quite well over here. I mean, look at this, look at this. So that kind of an appearance is what is going to be given the name or associated with the term, the fibrinoid necrosis, which is going to be again an important manifestation associated with polyarthritis nodosa. So far as this condition is concerned, because it is an example of a vasculitic condition, so usually immunosuppressive therapy in the form of steroids is likely to be helpful in this patient. Why that becomes important is also because of the fact that there may be certain examples of vasculitis which are going to be better off treated with the help of a non-steroidal therapy. We'll talk about them subsequently. As of now, this is what is going to take care of a discussion of PAN. Talking about the next important example of a medium-sized vessel vasculitis, you're going to be having a picture which is going to be causing involvement of a child typically less than 4 to 5 years of age. And this kind of a vasculitic disorder is going to be given the name of Kawasaki's disease. So as I always talk about the fact, Kawasaki's disease is an example of a pediatric disorder. It's a kid's disorder. Now this kind of a condition is characterized by the fact that patients are going to be having, almost all patients, 100% patients are going to be having the presence of fever. So that becomes very, very pertinent. And you need to be familiar with the fact that patients are going to be having other manifestations in the form of what is called by the name of the cream criteria. So let's just recall the cream criteria quickly. You have conjunctivitis, that is the non-exudative, non-purulent conjunctivitis. You have the presence of a skin rash. You have the presence of cervical lymphadenopathy, typically unilateral. You do have the presence of something like edema of hands and feet. Very, very important hint given in the stem of the question. And you do have presence of mucosal involvement, which can be appreciated over here as well. The child is going to be having the presence of a congestion in the oral cavity, and then the child is appearing very, very sick. Now, when we talk about this condition, a child having a fever, why this condition becomes important is because of the involvement of the vessel. And the characteristic vessel, which is going to be lethal for this child, can be the involvement of the coronary vessel. So the coronary vessel is actually going to be having the development of a weakness, because of which there can be a coronary artery aneurysm. And if there is going to be a coronary artery aneurysm, as you can make out over here, that compromises the blood supply to the heart, which makes this condition important because this is an example of a condition which can be responsible for causing development of myocardial infarction in a child. So for a fact-based question, the commonest reason for myocardial infarction in a child, think in terms of something like Kawasaki's disease. If there is a child who is having the presence of a fever, most important etiology in the routine world happens to be a viral infection. And usually in viral infections, you would not like to give a drug like aspirin for the treatment of fever because of, you very well understand, the aspirin can be responsible for causing development of Ray's syndrome, the mitochondrial dysfunction associated and then subsequent complications. But over here, in case of Kawasaki's disease, the child is at high risk for development of a coronary artery problem. Therefore, the management of this particular child is going to be done with the help of intravenous immunoglobulins. And so as to reduce the chances of development of myocardial infarction, what is also going to be given to this particular child is going to be antiplatelet therapy in the form of aspirin. So usually when you talk about vasculitis, majority of them have a good response with steroids. But for Kawasaki's, you need to remember the fact it is not steroids, it is the intravenous immunoglobulins along with aspirin, which is going to be the first line treatment to offer to this patient. The next important example of a vasculitis, which is very, very obvious from the name itself and something which they love to ask you in the exams these days again. So even in the NEET 2022 exam, even in the INI-CET exam, they did give you a picture of an individual who was a relatively young guy. So young male individual having a history of smoking, having the presence of a discoloration at the level of the digits. Quite characteristically associated with development of a condition that is going to be given the name of Buerger's disease. Now this Buerger's disease, not to be confused with the Buerger's disease that we read in nephrology, this condition is going to be given the name of thromboangiitis obliterans. The condition is characterized because of the presence of a hypersensitivity reaction to nicotine because of certain predisposing factors. What we have in these individuals therefore is going to be having the involvement of something like the popliteal artery, and the patients can be having the involvement of the radial artery as well. So the radial, the ulnar or the popliteal artery can be affected in these individuals. Of course, the commonest vessel affected in these individuals happens to be something like the tibial vessel, and therefore the individuals are going to be having symptoms because of a vascular compromise. So this guy can be having a presentation like he is a smoker, let's say for 10-15 years, and this guy is going to be having a trouble when he is walking, but the pain is going to initially settle down when he is taking rest. Pain on walking, settling down on taking rest. Intermittent claudication. Young male individual having a history of smoking, intermittent claudication. If he doesn't quit smoking, he can be subsequently having a development of digital gangrene, which can be manifested in the upper limb or might as well be seen affecting the digits of the lower limb as well. Now, this condition is going to be characterized by the fact, the name gives you a hint, thromboangiitis obliterans. There is such an important vascular damage that almost the complete lumen, as you can find over here, almost the complete lumen is going to be having a compromise, and therefore the blood supply is going to be severely reduced. Now, so as to save the life of this individual, the first advice I would like to give him obviously is going to be quit smoking. The second thing is we would be giving him something like vasodilator therapy, and if at all the drug therapy fails, or for that matter even a surgery like lumbar sympathectomy fails, the last resort that you have for these individuals happens to be amputation. So thromboangiitis obliterans characterized by the fact that there is going to be an involvement of a medium-sized vessel like a tibial artery or a popliteal artery or a radial artery, and then characterized by this particular fact. That is what you need to be familiar with so far as a condition like Buerger's disease should be remembered. Talking about something which is very commonly asked in the exam these days, what is given the name of ANCA, which is anti-neutrophilic cytoplasmic antibody. So as in the discussion of the main videos in the section under immunity, we have talked about different antibodies which are observed in different conditions. When you talk about ANCA, the anti-neutrophilic cytoplasmic antibody can be having two important variants. The one variant that is going to be given the name of what is termed as a C-ANCA, which is now being given the other important name. It is called by the name of PR3-ANCA, for the simple fact the antibody over here is produced against proteinase 3 antigen. On the other hand, when we are talking about something which is going to be the other type of ANCA, earlier called by the name of a P-ANCA, P stands for the fact that there is going to be a perinuclear staining that you are going to be observing over here. So this is the cytoplasmic staining, this is the nuclear area. If there is a perinuclear staining, that's a picture that you get. So P for perinuclear staining, and what you need to understand over here is that there is going to be the formation of antibodies against the antigen. Over here happens to be what is being given the name of myeloperoxidase. Different conditions are going to be having different subtypes of ANCAs being present in them, which can at times be serving as a hint for you to answer a question. For example, if I talk about a condition which is going to be associated with the presence of C-ANCA or the PR3-ANCA, the first important example of a vasculitis which would come to my mind is vaginous granulomatosis. Vaginous granulomatosis, which incidentally now is being given the name of granulomatosis with polyangiitis. If we talk about the P-ANCA can be seen in a patient who is going to be suffering from a condition which is given the name of microscopic polyangiitis. Now, this can also be seen in individuals who are going to be suffering from an inflammatory bowel disease. As we talked about in the GI tract section, a condition like ulcerative colitis, or for that matter condition like primary sclerosing cholangitis. We need to be familiar with the fact that sometimes some of the drug ingestions like propylthiouracil might as well also be associated with formation of the P-ANCA. So all in all, what I want you to remember is look at those stainings, should be able to identify the cytoplasmic area vis-a-vis the perinuclear area, and you need to be familiar with antigens, very potential question for the exam. And third point is you need to remember at least one prominent example of vasculitic condition in which you're going to be having either of them. So that is about ANCA that we need to be having an idea. Talking about an example of a small vessel vasculitis, this was an example of a condition that I was just making a mention of to you 2 minutes back. This was vaginous granulomatosis, also nowadays given the name of granulomatosis with polyangiitis. Now, as and when we are making a mention of this kind of a condition, let us just quickly recall the fact that there is a typical rule of involvement that we have in case of this kind of a condition. So, you have renal involvement, you have upper respiratory tract involvement, you have lower respiratory tract involvement. We have a variant of vaginous granulomatosis which is given the name of limited vaginous, in which you get only and only involvement of the lungs. So, when we are talking about the usual vaginous, the classical triad vaginous, in case of renal involvement, you have the development of crescentic glomerulonephritis. Recall the fact, what's the importance of knowing about crescentic glomerulonephritis? That's also given the name of RPGN. The glomerulonephritis which progresses rapidly, so can result in rapid renal failure. One of the important reasons of death in a patient having vaginous. Fact number 2, patients can be having involvement of upper respiratory tract. By that, the questions in the exam would be asking about a patient who is going to be having, let us say, a combination of otitis media. Then this guy is going to be having the presence of a septal perforation. This guy could also be having the presence of involvement of something like a pharyngitis. He could be having the involvement of other manifestations, say for example, something like the strawberry cramps. If we are talking about example of the lower respiratory tract, that would be involvement of lungs, you have cavitary lesions. Now, cavitary lesions would be associated with development of pneumonia. Patients can be having hemoptysis, patients can be having dyspnea, and the same cavitary lesions are also appreciated quite well radiologically. So these days, as is the trend wherein they give you a complete clinical picture, you need to be able to identify this condition because of one, involvement of the different kind of systems, involvement of the presence of an antibody over here, and that antibody, as I just now shared with you 2 minutes back, happens to be C-ANCA. What's the new name of C-ANCA? That's given the name of PR3-ANCA. That is what you just need to be keeping in mind. So far as this condition is concerned, this used to be an example of a life-threatening condition, but these days has a very good response to immunosuppressive therapy, and that becomes a pharmacology question. This condition has got an excellent response to an anti-cancer drug which is going to be having an immunosuppressive action as well, and the drug is going to be given the name of cyclophosphamide. So that is what is to be remembered. In the earlier days when cyclophosphamide was not being given to these patients, most of the patients actually succumbed to the fact that they had a development of uremia secondary to renal failure. That is what we need to have an idea so far as a vaginous granulomatosis or the granulomatosis with polyangiitis is concerned. Another important example of a small vessel vasculitis, which I would like you to just have an idea over here, is what is going to be given the name of Churg-Strauss syndrome. So that is an example of a condition characterized by an eosinophilic polyangiitis, and therefore an example of a condition that you associate quite commonly with a condition like bronchial asthma. Important example of the condition which they love to ask you in the exam then happens to be what is going to be given the name of arteriolosclerosis. The moment we are talking about arteriolosclerosis, this is going to be having two important variants. Let us just quickly recall both of them. First example of an arteriolosclerosis is the one in which you are going to be having the involvement of the vessel in a way where the vessels are going to be having that hyaline material deposition. So understandably, this is a condition that is going to be associated with the term hyaline arteriolosclerosis. These changes are most frequently observed in the renal blood vessels, and therefore we need to understand the fact that whenever we are talking about the hyaline arteriolosclerosis, this can be associated with a patient who is going to be suffering from diabetes, could be seen in a patient who is going to be suffering from benign hypertension, that's a routine hypertension that we observe clinically, and can be seen as a part and parcel of the routine aging. That means in elderly individuals, in patients who are hypertensive, in individuals who are diabetic, such an example of a hyaline deposition is relatively common, so that is what we need to be familiar with. Recall from our discussion in the renal main videos that such an involvement of the blood vessel compromises the blood supply, and that patchy involvement of the kidney cortex is going to be having an irregular surface. Remember the term leather grain appearance. On the other hand, when we are talking about the arteriolosclerosis in which you are going to be having the involvement of vessel in such a way, I mean look at this vessel, this is the lumen. You're going to be having the smooth muscle proliferating in a concentric fashion. You identify the tissue, this is a renal tissue because of the location of the glomerulus over here. So at almost the 1 o'clock position, between 1 to 2, you're going to be having the presence of a vessel which is going to show you the hyperplastic changes. You have the hyperplasia of the smooth muscles, so understandably, this is going to be an example of a hyperplastic arteriolosclerosis. Now, such an example of a change usually is an example of a response of the vessels whenever there is a sudden or severe increase in the blood pressure. And that particular condition that we just need to have an idea is what is going to be given the name of malignant hypertension. So, a typical question which is loved by the examiners to be asked is either they ask you to identify the histological picture, hyaline-like appearance, hyaline arteriolosclerosis, or hyperplasia of the smooth muscles, hyperplastic arteriolosclerosis, or they talk about the clinical conditions associated with them. So, the left one associated with diabetes, elderly individuals, routine hypertension, whereas the right one associated with malignant hypertension. Also, the gross appearance of the kidney would be radically different in these two conditions. On the left side, you would be having the presence of a leather grain appearance of the kidney. I'll talk about that in the renal section, RR as well. And on the right side, you're going to be having the presence of what is termed as a flea-bitten kidney. So this is what is likely to take care of a lot of questions that they commonly put up to you in the exams. Talking about the next important example of a condition which is going to be affecting the vessels, this condition is going to be given the term Monkey-Burg sclerosis. Now, the moment we talk about Monkey-Burg sclerosis, there is a certain fixed pattern of questions that is loved by the examiners. You see, clinically, this is an example of a condition which doesn't bother me as a physician. Why? Because of the fact Monkey-Burg sclerosis causes involvement of the tunica media. There is a degeneration of the smooth muscle cells over there, and therefore what you find over here is that there would be calcium deposition in the tunica media. Because of the fact that there is going to be a calcium deposition in the tunica media, the vessel is going to become hard to palpate. So in case of an individual, suppose you take the pulse of an individual, you're trying to palpate the vessel, the radial vessel, it appears very hard, but the individual doesn't have a problem. You see, there is no compromise with the lumen as such. So that is a condition that is typically a Monkey-Burg sclerosis. So nothing has to be done as such for the individual, but then from the perspective of the MCQ exam, you need to remember the tunica media involvement. You need to be familiar with the fact that these individuals are going to be having calcium deposition. So that would be dystrophic calcification. And you need to be familiar with the fact that usually these individuals are going to be asymptomatic. So that is all that you need to be familiar with so far as Monkey-Burg sclerosis is concerned. Of course, if somebody was to ask you that such a picture is going to be observed under the routine hematoxylin eosin staining, and of course, we talk about the fact that calcium can be picked up with the help of special stains like von Cossa, alizarin, red. That's what we need to be familiar with for this condition. Talking about the next important example of a condition which is going to be contributing to lot of morbidity, lot of mortality, that is going to be given the name of atherosclerosis. Now, atherosclerosis is an example of a condition initially beginning in the intima. That's one question, because of the fact that the individuals are going to be having the development of endothelial cell injury. So, as is known to majority of you, atherosclerosis is now being defined as a response to the vascular injury starting from the endothelial cells. Of course, as time progresses, this is going to be causing involvement of the media and the adventitia as well. Now, this atherosclerosis classically is going to cause involvement of the abdominal aorta. You then get involvement of the coronary artery. You then get involvement of the popliteal artery. You can get involvement of the descending thoracic artery. Of course, you can get involvement of the circle of Willis. So, in the descending order, that is what is to be remembered. That is what used to be a favorite question for the PG examiners. I repeat the fact, in context of involvement of the abdominal aorta, you are going to be having a tendency of the abdominal aorta to weaken and therefore associated with a true aneurysm formation. On the other hand, when we are talking about the involvement of the coronary artery, it is a LAD which is most commonly going to be affected in these individuals, and because of the involvement of LAD, remember the fact, LAD supplies apex, anterior wall of the left ventricle and interior part of the interventricular septum. So all those areas are going to be having a vascular compromise. It makes them weak. Therefore, clinically the commonest type of MI that is going to be observed in the patients is going to be anterior wall MI. Since we can get involvement of the popliteal artery, there can be aneurysm formation in the popliteal artery as well, and that is going to be helpful for you to recall. Popliteal artery is the commonest peripheral vessel showing you aneurysm formation. Involvement of the circle of Willis can be responsible for causing development of the manifestations in the form of stroke. Now, as and when we are making a mention of something like atherosclerosis, what we need to remember over here is going to be the clinical picture. There is going to be presence of these empty looking areas. The empty looking areas are nothing but they are just representative of what is going to be given the name the cholesterol needle and clefts. So, cholesterol deposition taking place within the vessel wall, and on the staining we understand glycogen and lipids usually get washed off. So, what we have over here is those cholesterol needle like areas. That is what is to be remembered over here. Of course, that should not help you forget that we do have the presence of something given the name of foam cells. These are modified macrophages which are going to be containing the presence of the lipids as well. So, modified macrophages, foam cells is what they ask you in the exam, and apart from macrophages, even smooth muscle cells can be at times behaving as foam cells. So, this is an important thing that you need to remember from the exam from the perspective of the questions that they put up to you with respect to atherosclerosis. Talking about a passing reference with respect to something, a condition that is going to be given the name of cystic medial degeneration. So, usually the elastin fibers are going to be having a regular arrangement, but as and when they are going to be having a haphazard arrangement which can be observed over here, that can be seen in a lot of connective tissue disorders, say for example something like Marfan syndrome as well, and that is going to be responsible for causing a compromise of the vascular integrity. Therefore, the individuals can be having the ballooning of the vessel, that is aneurysm formation, or at times this can even be associated with something like a catastrophic rupture. So, that is what we just need to be having an idea, something that is going to be given the name of cystic medial degeneration. Talking about the next one, we are going to be having an image in which we are going to be having the depiction of the renal vessels, that is the kidneys, and therefore you have the renal vessels over there, and this is going to be the bifurcation of the abdominal aorta into the common iliac vessel. Therefore, what it shows you over here is ballooning of this area below the origin of the renal artery, above the bifurcation into common iliac artery. Below the origin of the renal artery, above the bifurcation into common iliac artery, this is going to be the commonest site of a true aneurysm. True aneurysm. True aneurysm, as we discussed 2 minutes back, the commonest reason happens to be the condition that is going to be given the name of atherosclerosis. However, you need to be familiar with the fact that for certain conditions, for example, if I talk about an example of a sexually transmitted disease, syphilis, you are more likely to be getting the involvement of the ascending aorta. So, abdominal aortic involvement typically is going to be caused because of atherosclerotic aneurysm over here, whereas syphilitic involvement is going to be associated with involvement of the ascending aorta and might as well cause involvement of the aortic arch. The moment we are going to be talking about this term, true aneurysm, there would something which is going to be striking your mind about what is going to be given the name of a false aneurysm or a pseudoaneurysm. Remember the fact, the commonest reason for development of a pseudoaneurysm is going to be post-myocardial infarction rupture. So, that's another important thing that they'll have to ask you in the exam. So, we should be recalling in the exams quite correctly the different causes of true as well as pseudoaneurysm, not to forget the cause of a true aneurysm, not to forget the commonest site. That is what we need to have an idea so far as this kind of a condition is concerned. Talking about the next important example of a condition, this would be an example of vasculitic disorder which is going to be associated with a sexually transmitted disease like syphilis. So syphilis, which is caused because of Treponema pallidum, particularly in the tertiary stage, can be causing the involvement of the aorta, so much so that the patients can be having the involvement of the ascending aorta, and that is where the damage to the aorta has been seen, and therefore you can find over there the clot as well as appearance of the heart. There is also going to be valvular damage which is going to be associated with certain terms that they love to ask in the exam, what is going to be given the name of cor bovinum. Additionally, we just need to remember the fact that in case of syphilis, you are going to be having a patchy fibrosis which gives a characteristic appearance to the blood vessel over here. The blood vessel is going to be having an appearance that is called by the name of a tree bark appearance. So, involvement of the ascending aorta, involvement of the heart in the form of cor bovinum, cow heart, presence of tree bark appearance, all that goes in favor of something like a syphilitic involvement typically seen in the tertiary stage of syphilis. Talking about the next important image, this is going to be a very important condition, in fact a catastrophe if you were to actually encounter a patient who is going to be suffering from this condition. This is going to be a representation of a condition that is going to be given the name of aortic dissection. Recall from our discussion, as a basic fact, blood flows inside the lumen of a vessel. If there is a weakness at the level of the vessel wall, there is a possibility that the blood which is flowing in the lumen can also flow within the layers of the vessel wall, and that's exactly what you find over here. So you would be expecting the blood to be flowing over there, but then the blood also is going to be entering over here in this area. This is going to be because of a weakness at the level of the vessel wall, and one of the important reasons for development of the weakness in the vessel wall is the cystic medial degeneration. Whenever there is going to be a weakness in the vessel wall, whatever be the cause, if there is going to be an increase in the blood pressure, it means whenever the individual is going to be having a hypertension, the chances of the blood entering into the weaker area, into the layers of the vessel wall becomes very high. Therefore, this is going to be having a presentation in the form of a patient having a sudden onset of a severe pain, and this pain is usually going to be associated with its radiation at the back as well. As and when you do the radiological investigation, this is what should alert a radiologist that this is the lumen and the blood is also present over here. So you have one lumen, you have the other lumen, that is what is going to be given the name of a double barrel aorta. So double barrel aorta is going to be an important reason where the radiologist would actually call a cardiothoracic surgeon right away that you have a patient who is in a catastrophe, he can die if not being taken properly care of. The reason, because of the simple fact there is a vessel which is having the moving blood in the vascular wall within the layers. So if the pressure slightly increases, there is a complete rupture and that can be fatal. So therefore, this appearance is what has been asked in the exam so many times earlier, you should be able to pick it up. As well as be familiar with the fact that aortic dissection is going to be caused because of a weakness over here. As I explained you, one of the important things that you have to target over here is to control the hypertension, to control the blood pressure of the affected individual, to be done with the help of maybe the ganglion blockers, what you read in pharmacology, trimethophan, or maybe give them a drug like sodium nitroprusside as well. Additionally, in aortic dissection, what they may ask you in the exam is a name of a special stain for which a very beautiful image has been given in the textbook Robbins, what is given the name of Mowat stain. The Mowat stain actually is going to be showing you the presence of elastin fibers in the black color, and the book has a very beautiful image which I would personally recommend you to please go and have a look at when you're going to be looking at the Mowat staining, which is going to be making the diagnosis quite confirmatory. So radiologically, this particular point is important, the double barrel aorta. Of course, the histopathological picture is important, and not to forget the fact that the blood pressure of the patients have to be controlled at all possible costs to save the life of the individual. Talking about the next important example of an image which will remind you of a classical history in context of a female who in the winter months is going to be washing her clothes, and then what she finds after some time is that there is going to be a complete discoloration so far as her fingers is concerned. So that kind of phenomena is what I would like you to be familiar with over here. This is going to be given the name of the Raynaud's phenomena. Any kind of a history of exposure to cold weather, or let us say washing clothes in the cold water, or for that matter use of a vibrating instrument like certain tools, can be responsible for having the development of a change in the color of the digits. What's the sequence of color change? White followed by blue followed by red, right? That is what they'll have to ask you in the exam. You can be having this condition as an idiopathic condition, what is being given the name of a primary Raynaud's, or this could be an example of a condition secondary to Burgess disease, atherosclerosis, scleroderma. In fact, you would be able to recall the fact that Raynaud's is one of the earliest manifestations of a condition like scleroderma or systemic sclerosis. So that's another important thing that you just need to be aware of. Now, because this condition is characterized by a vasospasm, so patients are going to be having a relief the moment you remove the risk factor. So bring them, let us say, to the warm area or the rewarming is being done, or the administration of certain types of vasodilators. That is what we need to be having an idea so far as Raynaud's phenomena is concerned. Having a word just about making a passing reference to a condition that is going to be given the name of certain types of vascular tumors. The first one I am making a mention of is an example of a condition that is going to be given the name of a capillary hemangioma. Capillary hemangioma has been a 2 times asked question in the recent exams. So you just need to be familiar with the fact that this is going to be an example of the commonest vascular tumor. Now this is an example of a tumor, as you can understand the fact that there is going to be presence of collection of the blood, and if you can appreciate over here, there is going to be a very limited amount of stroma. The reason for the limited amount of stroma is that this condition, the name gives you a hint, capillary hemangioma causes involvement of the capillaries, and therefore the amount of connective tissue per se is going to be very less. So you are having a collection of blood over there, and there is going to be less involvement of the interstitial connective tissue, or that is very thin. But importance is that this is an example of the commonest vascular tumor. The other important thing that you need to remember over here is that for a lot of conditions, lot of individuals, capillary hemangioma is an example of a condition which 70% of the hemangiomas are going to regress by the age of 7 years. This is in complete contrast with a condition that is going to be given the name of a cavernous hemangioma. Caverns means big spaces, cavernous hemangioma. So when you are talking about something like capillary hemangioma, I would like you to understand the fact that you are having the involvement of small vessels and therefore collection of blood with less connective tissue. However, the moment you hear about the term cavernous over here, you need to understand the fact that these are example of blood-filled spaces, but just have, for the sake of a comparison, have a look at the amount of connective tissue that you have over here. For the simple fact that yes, veins are going to be having the presence of more amount of connective tissue, so that is what is to be remembered over here. So in the exam, if you have a vascular area which is going to be affected more, and you are going to be having a thin involvement of the connective tissue, that goes in favor of capillary hemangioma. Of course, there are different variants of the histological pictures that are available on the net, as well as which have been asked in the exam. And as and when there are big areas, but then you find relatively more amount of connective tissue as well, that is going to be associated with something like cavernous hemangioma. Another important example of a tumor which the examiners love to ask you time and again happens to be a condition that is going to be given the name of Kaposi's sarcoma. Kaposi's sarcoma would be an example of a condition that is going to be characterized by the fact that in these individuals you are going to be having the involvement caused by the infectious organism, that is human herpes virus subtype 8, nowadays also given the name of Kaposi's sarcoma herpes virus. This is an example of a tumor which is going to be vascular in origin, and you are going to be having the presence of, you can appreciate it over there, you can be having the presence of something like the spindle shaped cells over here. Typical location of this kind of a tumor, as you need to understand, is going to be, it is going to be present at the level of the lower limbs. And because of the fact that the tumor is going to be usually going to be having the presence of spindle cells, as well as it is going to be having the involvement of the lower limbs, you need to be aware of the fact that there is going to be a manifestation in the form of discoloration of the skin. So very important example of a tumor, because that is a tumor that you associate in a patient who is going to be suffering from AIDS. In fact, one of the important examples of tumors which is going to be divided or coming into the category of the AIDS defining malignancy. So yes, you are going to be having the presence of Kaposi's sarcoma, you are going to be having the presence of something like a cervical cancer, and you do have the presence of something like a CNS lymphoma. All these three are examples of the AIDS defining neoplasms. Talking about the next important example of a vascular tumor, this is an example of actually a very deadly tumor, thankfully relatively rare, but then the tumor is something which is loved by the examiners to be asked time and again, and therefore we talk about that in the form of angiosarcoma. So sarcoma, it's an example of a malignant tumor arising from the blood vessels, angiosarcoma. The condition is characterized by the fact that there is an infiltration of tumor cells in large quantities over here. I would just like you to recall the fact, just tap your brains and talk about the answer of the etiological factors associated with angiosarcoma. So tap your brain, thorotrust, you remember that thorotrust, example of a radiological contrast medium which was used earlier. We then talk about exposure to a heavy metal like arsenic. We then also talk about the worker who's going to be working in a plastic factory, the polyvinyl chloride. So TAP, tap your brains, thorotrust, arsenic and polyvinyl chloride are associated with development of angiosarcoma. How do you deduce, how do you look out for the fact whether this particular tumor is going to be having a vascular origin? So we understand the fact that endothelial cells are going to be having the presence of von Willebrand factor. Alternatively, you are going to be using an important example of a stain that is given the name of, the marker is CD31. So with the help of special ones, the special molecular markers or the ISC stains for VWF as well as CD31, you are able to pick up a tumor like angiosarcoma. I repeat, something which is very rare, but etiological factors and the markers are what is loved by the examiners to be asked to you time and again. That is what we need to be familiar with so far as an angiosarcoma is concerned.